Welcome to the EWC, or Every Woman Counts, pre-recorded English curriculum. EWC provides free breast and cervical cancer screening and diagnostic services to Californians. The mission of EWC is to save lives by preventing and reducing the devastating effects of cancer for Californians through public and provider education, early detection, diagnosis, case management, and integrated preventive services. EWC is part of the Department of Healthcare Services Benefits Division. Although this program is called Every Woman Counts, it is important to know that transgender and non-binary genders are included in its services as relevant for people's individual healthcare needs. If you have questions, would like additional information, or would like to be reached out to by a program representative, please see the notes and information below this video. What is cancer? There are many different kinds of cancers. It's not just one disease. Cancer begins when abnormal or damaged cells cannot repair themselves and become tumors, though not all tumors are cancerous. In all types of cancer, the normal cells in the body change, become abnormal, and grow out of control. Today, we're going to talk about breast and cervical cancer, screening and early detection. Breast cancer is the most commonly diagnosed cancer in California. The second most common cancer is prostate, and the third is lung. 1 in 8 people will get breast cancer in their lifetime. It's important to note that the EWC program covers breast and cervical cancer screenings for people who were assigned female at birth, whether or not they identify as a woman. What makes people more at risk for breast cancer? While we still don't know what causes breast cancer, there are risk factors that may increase your chances of getting breast cancer. A risk factor is anything that affects your body's chances of getting a disease. It could be a lifestyle choice such as diet and exercise, your body's unique cells, or a history of cancer in you or your family. An example, the sun may cause skin cancer, or smoking may cause lung cancer. There are different kinds of risk factors. Some risk factors, such as a person's age, body type, or family disease history, cannot be changed. Still, other risk factors are related to personal behaviors, lifestyles, or the environment, and these may be able to be changed. Get to know your family history of cancer and share this information with a clinical provider. The 2 main risk factors for breast cancer are of the type that you cannot change. This is another reason why regular screenings are so important. The 2 main risk factors are having breast and female hormones and getting older. People most at risk for breast cancer are women, trans men, and trans women who have breasts and/or are taking female hormones. People 50 years and older are more likely to get breast cancer. Men and young women can get breast cancer as well, but at much lower rates. Other risk factors are related to personal behaviors, lifestyles, or the environment, and may be able to be changed. For breast cancer, this includes exercise, diet, alcohol use, and smoking. How can you help detect breast cancer early? Know how your body looks and feels normally so that you can notice if there are any changes to your breast or chest area, from the clavicle to below the breast, and from the center of the chest to the armpits. Let your provider know if you see or feel any changes. See a provider regularly for your healthcare needs and for screening, even without symptoms. When breast cancer tumors are found early, before spreading outside of the breast or chest area, there are more options for treatment, and less treatment may be needed. What are some signs and symptoms that someone might have breast cancer? It is possible to have no symptoms for breast cancer, especially in the early stages. A new lump in the breast, chest, underarm, or armpit is the most common symptom, although any breast changes should be checked out by a provider. Other signs and symptoms include swelling or thickening of all or part of a breast, pulling in or turning in of the nipple, change in skin color or flaky skin on the nipple or the breast, nipple discharge, not breast milk, including blood, irritation or dimpling of the breast skin, pain in any area of the breast, or any change in the size or the shape of the breast. Breast self-exams can be an important starting place to understanding how your breasts normally look and feel, and any changes you notice should be communicated to your provider. Clinical breast exams are covered once a year for people ages 40 and older through EWC. Talk with your provider about how often you should have a clinical breast exam, especially if you have family or a personal history of breast cancer or other risk factors. Another tool for finding breast cancer early is a mammogram. The mammogram is an X-ray picture of your breast or chest area, and it can help find breast cancer that is too small for you or your provider to feel. It would be difficult for people to feel such a small lump on their own, as you may see in this picture. It's the best way to detect breast cancer early. EWC covers mammograms starting at age 40 every 1 to 2 years. EWC covers mammograms when a person has any new or abnormal changes or possible signs or symptoms of breast cancer at any age. Speak with your provider about when to start breast cancer screening and how often you should have a mammogram, especially if you have family or a personal history of breast cancer or other increased risk factors. If you would like additional information, have questions, or would like a program representative to reach out to you, please see the information located below this video or at the end of this presentation. What is cervical cancer? When cancer occurs in the cervix, it is called cervical cancer. Cervical cancer grows very slowly, and the changes cannot be seen on the outside of the body. Any abnormalities can be found and removed or treated before they become cancer by seeing a provider regularly for checkups. Cervical cancer is nearly 100% preventable. Where is the cervix? The cervix is the lower, narrow end of the uterus or womb. The cervix connects the vagina to the uterus. The uterus is where a baby grows when a woman's pregnant. Cervical cancer grows very slowly, and the changes cannot be seen on the outside of the body. Cervical cancer is usually caused by a virus called the human papillomavirus, or HPV. HPV is a very common virus. 1 in 4 people have HPV. Most of the time, roughly 9 out of 10 times, HPV does not cause health issues and goes away on its own by the immune system fighting it off, like a cold virus. The main risk factor for cervical cancer is a high-risk type of HPV infection that does not go away on its own. All people who have a cervix and have had sex are at risk for cervical cancer. Cervical cancer occurs most often in people over the age of 30. HPV is passed from person to person, usually during sexual activity. Direct genital skin-to-skin contact or oral sex can also pass HPV from person to person. Getting a Pap test regularly is the best way to catch and treat any abnormal cell changes early on before they cause cancer. There is a vaccine to protect against the HPV types that cause most cervical cancer and genital warts. The HPV vaccine is recommended for preteen girls and boys at age 11 or 12. HPV vaccines are also recommended for teen girls and young women as early as 9 through the age of 26, as well as teen boys and young men through the age of 21 if they did not get the vaccines when they were younger. The HPV vaccine is only effective before people come into contact with the types of HPV covered by the vaccine, or before they are sexually active. This slide shows other risk factors for cervical cancer. When seeing a provider for cervical cancer screening, they can do a Pap test and/or an HPV test during a pelvic exam. The Pap test looks for abnormal cells on the cervix that can turn into cancer over time. The Pap test is the best way to lower cervical cancer risk by catching abnormal cell growth early on. The HPV test looks for the specific types of HPV that can cause abnormal cells on the cervix. What do the results mean? Cell changes that are not cancer are commonly found. HPV tests tell if any abnormal cell growth is from the virus that causes most cervical cancer. People should start getting regular Pap tests at age 21, even if they are not yet sexually active. This is due to the percentage of cervical cancer that is not caused by HPV. If Pap test results are normal, providers may say that the patient will not need another Pap test for 3 to 5 years. It is important to ask your provider how often you should be screened based on your personal history and risk factors. EWC will pay for an initial pelvic exam to determine the presence of a cervix. People aged 30 or older may choose to have an HPV test along with the Pap test. For people ages 30 to 65, it is important to continue getting a Pap test as directed by their provider, even if they think they are too old to have a child or are not having sex anymore. However, providers may say a Pap test is no longer necessary if either of these are true. 1. The patient is older than 65 and has had normal Pap test results for several years. Or 2. The patient had their cervix removed as part of a total hysterectomy or non-cancerous conditions such as fibroids. If you would like additional information, have questions, or would like a program representative to reach out to you, please see the information located below this video or at the end of this presentation. There are lifestyle risks that you can change through these breast and cervical cancer risk reduction steps. Maintain a healthy weight. Eat healthy. Have a regular goal of getting at least 30 minutes of exercise per day and make sure you get enough exercise throughout the week. Don't smoke. Don't drink too much alcohol. No more than 1 drink per day is recommended. And use a barrier protection method such as a condom during sexual activity. Also, reduce or limit the number of sexual partners you have. One of the most important things we can do for our health is to get to know our bodies and trust ourselves to get help when we think something is wrong or not normal for us. Since much of the time there are no signs or symptoms, it is even more important to get regular screenings as part of your preventive health care. Screenings and early treatment save many people's lives, and they can save your life too. Now that we know how common breast and cervical cancer are, and we know some specific things people can do to reduce their own risk, the most important of these being getting mammograms and Pap tests, let's talk about why it might be hard for some people to get screened. So let's ask ourselves, what gets in the way of people being screened? Some common answers we hear are feeling embarrassed, modesty and or discomfort with certain parts of one's body, feeling like that won't happen to me, a lack of health insurance, a lack of transportation, fear of pain or the fear of a diagnosis, an unfriendly provider where people have been made to feel uncomfortable with personal treatment in their past due to their age or identity, or a lack of time for self-care in general. EWC offers screening assistance and patient navigation services so that you will always have someone working with you throughout the entire screening process. You are never alone. The EWC program offers free cervical cancer screening for people ages 21 and over, free breast cancer screening for people ages 40 and over, free breast cancer testing for symptomatic people of any age regardless of gender identity, providers in your neighborhood, appointments from Monday to Friday from 8:30 a.m. to 5 p.m., also available if needed after 5 p.m. and on weekends depending on the provider, and services available in different languages. To use the EWC program, a person must meet the following criteria. The person must live in California. They must not have other insurance, including Medi-Cal. If the person does have insurance, they must have a high deductible or copayment, and they must meet income requirements. To use EWC, a person does not need to be a U.S. citizen, a U.S. national, or have a social security number. There are 2 ways to find a provider for an appointment with EWC. 1. Call EWC at 1-800-511-2300 for automated referral to providers in your area. The call is free and confidential. Information can be provided in the following languages: English, Spanish, Mixteco, Mandarin, Cantonese, Korean, Cambodian or Khmer, Hmong, Russian, Tagalog, Farsi, Arabic, Armenian, Hindi, Japanese, Punjabi, Thai, Laotian, and Vietnamese. Number 2. Search for EWC providers using the online provider locator at dhcs.gov cancer.ca.gov/everywomancounts. That link is also available in the space below this video. A link to our online participant forum is also available in the space below this video. You may opt in to screening assistance or patient navigation, and an EWC staff person will reach out to you to help answer your questions. A great tool for appointment reminders, the EWC Check Me mobile app will help you keep important breast and cervical cancer screening appointments. This tool is free and available in the mobile app store and Google Play for iPhone, iPad, and Android users. If breast or cervical cancer is diagnosed, the patient will be referred for free treatment to the Breast and Cervical Cancer Treatment Program, or BCCTP, available at 1-800-824-0088. Finding and treating cancer early saves lives. Please don't delay getting treated if diagnosed. Compared to the eligibility requirements for the EWC program mentioned earlier, the eligibility criteria for full healthcare coverage through Medi-Cal and/or Covered California is: a person must be a U.S. citizen, a U.S. national, or have legal residency. Financial help is available, or subsidies, for people who qualify with a lower income status. Medi-Cal and Covered California health insurance covers breast and cervical cancer screenings, plus prevention services, urgent care, emergency visits, and prescriptions. To apply for full healthcare coverage through Medi-Cal and/or Covered California, do one of the following. 1. Call 1-800-300-1506, TTY number 1-888-889-4500. 2. Apply online at coveredca.com. 3. Go to a human or social services office. Annual enrollment for Covered California is from November 1st to January 31st of the following year. Medi-Cal applications are accepted year-round. Now that you know about EWC's services and when and how to get screened, consider what other support you might find helpful to get your regular checkups. Remember, EWC provides screening assistance and patient navigation services, and you can opt into the services to have an EWC staff person reach out to you to help you get your screenings. To learn more or to sign up for screening assistance or patient navigation, complete the participant form available in the link below this video. Let's summarize what we've discussed. 1. Know your family and personal history of cancer and ask a provider for your recommended screening schedule. 2. Get to know your own body, and if you notice any changes, get checked out by a provider. 3. Get regular medical checkups for breast and cervical cancer screenings. Thank you for watching and for prioritizing your health. For more information, please go to the EWC website or contact the program at the number provided here. Contact information for the Tri-County Regional Staff serving San Luis Obispo, Santa Barbara, and Ventura counties is also available here and in the space below this video. If you would like assistance in getting your screenings, please follow the link to our online participant forum below this video. Thank you.